Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Bunions and Calluses. Introduction. A bunion is a hard bump at the base of the big toe. It happens when bone or tissue grows around the joint. It can cause the big toe to point inwards towards the other toes. Bunions often rub against a person's shoe. This can cause a callus over the bunion. Calluses are areas of thickened, dead skin caused by pressure or repeated rubbing of the skin. Calluses are usually not serious. This program will help you better understand bunions and related calluses. It covers symptoms and causes as well as treatment options. The feet. The feet consist of many bones, joints, and soft, flexible tissues. Joints act as hinges. They separate bones. Joints, along with muscles, let the foot and toes move. Joints are covered by a fluid-filled sac that acts as a cushion. It is known as a bursa. The foot has 5 toes. The big toe is called the hallux. The big toe connects to the foot by a joint. This joint is known as the metatarsophalangeal joint. Bunions typically affect this joint. A normal, healthy big toe is fairly straight. The tip of the toe points in relatively the same direction as the other toes. Bunions cause the tip of the big toe to turn inward towards the other toes. Sometimes areas of skin on the outside of the foot can become thick. These thickened, hard areas of skin are called calluses. They develop to protect skin that is being rubbed repeatedly. Symptoms and causes. A bunion happens over time when weight is distributed improperly across the foot. This can enlarge the joint at the base of the big toe. Improper weight distribution is usually the result of tight-fitting or high-heeled shoes. It can also be caused by injuries to the foot or by the foot's shape. A bunion can be painful. It can cause bursitis, a painful inflammation of the bursa. A callus may form over a bunion. They develop to protect skin that is being rubbed repeatedly. If this happens, your skin will become hard and thick. It may become dry and flaky. Calluses usually do not cause pain unless they crack from being too dry. Shoes that are too tight or too loose also cause calluses. Calluses may fade over time if you begin wearing shoes that fit well. Not wearing socks with your shoes or wearing certain kinds of sandals may also cause repeated rubbing. Socks that do not fit well can also cause calluses.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Risk factors. People with certain risk factors are more likely than others to develop bunions and calluses. A risk factor is something that may increase the chance of developing a condition. Having one or more risk factors does not mean that a person will get bunions or calluses. It is also possible to develop the conditions without any risk factors. Bunions and the calluses they cause tend to run in families. If a close relative has had a bunion, you are more likely to develop one as well. Women are more likely than men to develop bunions and calluses because of their footwear, which tends to be narrower. If you have flat or pronated feet, you are more likely to have bunions and calluses. A flat foot has a low arch or possibly no arch at all. The entire sole of the foot contacts the ground. A pronated foot rolls inward when a person is running or walking. Weight is not evenly distributed. People are more likely to develop bunions and related calluses if they are born with bone abnormalities in their feet. Diagnosis. Your healthcare provider will also ask you questions about your personal and family medical history. Your healthcare provider will perform a physical exam. He or she will examine your foot. Sometimes an X-ray is needed to diagnose a structural problem in the bones of the foot. This can also show if you have arthritis. Treatment. If your bunion is not severe, changing your shoes to a more comfortable design with more space for your toes may help. Bunion pads and medical or athletic tape can be used to hold your foot in a more normal position. Special pads for your shoes can be used to help distribute weight more evenly. Prescription orthopedic shoes and inserts may also be helpful. Over-the-counter medications like acetaminophen and ibuprofen may help reduce pain and inflammation caused by bunions. Steroid injections around the joint may also help. When non-surgical treatments fail to control the pain, or when a bunion is severe, surgery may be needed. Surgery to remove and correct a bunion is called a bunionectomy. Reducing friction or rubbing is important to get rid of calluses. To help calluses fade, buy shoes that fit well. Use bunion pads or medical tape. Try special pads or inserts for your shoes. To soften calluses, you can soak your feet in warm, soapy water. Lotion or moisturizer also helps keep your skin soft. If you do not have diabetes or poor circulation, you can try to remove the hardened skin with a pumice stone. You can also try pads that contain salicylic acid. Check with your healthcare provider first if you have any questions or if you have diabetes or poor circulation. If you have a callus on your bunion, treating the bunion could prevent any calluses from returning. Complications. Without treatment, bunions can lead to complications, but complications from calluses are rare. Your risk for complications is higher if you have diabetes or other circulatory problems. Bunions may cause chronic foot pain if not treated. Your foot may also feel stiff. A deformity of your foot may happen if a bunion is not treated. If you have diabetes or poor circulation, check with your healthcare provider before trying treatments at home. Never try to remove calluses yourself. This could cause an infection or sore. Check your feet regularly for any problems if you have diabetes or poor circulation in your feet. Report any problems to your healthcare provider.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A bunion is a hard bump at the base of the big toe. It happens when bone or tissue grows around the joint. It can cause the big toe to point inwards towards the other toes. A bunion happens over time when weight is distributed improperly across the foot. Sometimes spots of skin on the outside of the foot can become thick. These thickened, hard areas of skin are called calluses. They develop to protect skin that is being rubbed repeatedly. Shoes that are too tight or too loose also cause calluses. If your bunion is not severe, changing your shoes to a more comfortable design with more space for your toes may help. Treatment may include bunion pads and medical or athletic tape, special inserts for your shoes, over-the-counter pain medicines, steroid injections around the joint, bunionectomy. Reducing friction or rubbing is important to get rid of calluses. To help calluses fade, change your shoes. Use bunion pads or medical tape. Try special pads or inserts for your shoes. Without treatment, bunions can lead to complications, but complications from calluses are rare. Your risk for complications is higher if you have diabetes or other circulatory problems. Check your feet regularly for any problems. Report any problems to your healthcare provider.
Thank you for using Explain.